robotics and engineering. So how does it help us? It helps a surgeon in operating in inaccessible areas of human body with ease and comfort. So how does it help the patient? It helps the patient with minimal or hidden scars, reduced blood loss, early recovery, minimum wound-related complications, and reduced hospital stay. So this is the basic robotic surgical system. It has, as you can see, it has got three parts. This is the master control. This is wherein the surgeon sits, the chief operating surgeon sits. This is the patient cart. This is by the side of the patient, wherein we place the instruments into the patient's abdominal cavity, oral cavity, whatever. And this is the vision cart. This is the vision card. So this is the master, this is the slave, and this communicates between the two. There are cables that go from this to this and this to this. Whatever master orders, the slave performs the procedure. So there are many robotic systems that are working all over the world currently. There are many types of systems. By far, this is the most, Da Vinci system is the most common, most capable and versatile. And this is, of course, the most expensive also. Other systems, Versailles, Hugo, Zeus, and last one, this is SS Mantra, this is made in India. This technology has been developed in India by a surgeon, only is a thoracic surgeon from Odisha or Bhubaneswar somewhere. He has developed this robot. But more robotic systems, as you saw in the previous slide, this master cart has got many arms. So we have to make at least 3 or 4 holes in the abdomen to gain access to the organ. What this newer technology does, it has got a single port through which flexible instruments, flexible arms enter into the abdominal cavity, and we can do the procedure from a single port. Only one small incision. This has not come in India as of yet, but this is what we are looking into the future. As you can see, the arms are flexible. They go into a single port and later they diverge once they are inside the abdominal cavity, and we can perform the surgery comfortably. You can see it can work in a very small space very comfortably with this system. This is a single port Da Vinci system. We in India as of now don't have this, but in USA they are working on this. So what are the benefits of robotic surgery? First is intuitive motion. In laparoscopy is also minimally invasive surgery, everybody knows, but there is a lot of strain on the surgeon, and there is limitation of laparoscopic surgery. Surgeon gets fatigued, and the instruments cannot move in each and every direction. It has got certain degrees of freedom. The instrument can either open or we can rotate the instrument. Here, this is not the case with the robotic system. Whatever, as you can move your hands as in open surgery, the instrument translates the same motion. Whether it's flexion, extension, external rotation, internal rotation, circumflexion, it has a wrist. Each instrument has a wrist here. You can rotate your hand like this, the instrument inside can rotate like this. It replicates the same movement, which is not possible in laparoscopic surgery. So it gives us the benefits of both of them, minimally invasive laparoscopic surgery and open surgery. Of course, you have better vision. It has got better vision than even the most advanced laparoscopic systems. There is 10 times magnification, and more importantly, there is depth perception because the vision is 3-dimensional vision. Then there is the opportunity to train our trainees also, fellows, residents. This is a dual control system, wherein in one of the consoles a chief surgeon will sit, another console the trainee surgeon will sit. The chief surgeon can direct by pointers where a trainee surgeon has to dissect, or he can limit him, he cannot go beyond a certain point for him to understand and to learn the surgery. In this slide, you can see in surgical system, Da-Vinci surgical system, there is a surgical simulator also. Before a trainee surgeon actually sits on the patient, actual patient, there is a simulator that replicates the surgery itself. There are certain procedures so that he can harness his what you call skills before actually operating on the patient. And this is the evolution of minimally invasive surgical technology. From 90s, it was traditional laparoscopy. By the turn of the century, Da Vinci was into the vogue, and early in the first decade of the century, we had Da Vinci S system and SI. In the second decade of this century, by 2014-2015, Da Vinci XI came, which is by far the most capable and most versatile robotic system available. So as I was saying, the advantage is the 10 times magnification, a 3D vision, freedom of motion, precision and control. Suppose if a surgeon has a tremor, if a surgeon is a tremor, he is operating by an open technique. This tremor reflects on his movements. Likewise, during the laparoscopic surgery also, the tremor will reflect in the movement of his instruments. But in robotic systems, the tremor gets filtered. The tremor will not reflect in the movement of the instrument, so the surgery will be more precise. The dissection will be meticulous. So, really, we have got benefits of both the worlds, open surgery and laparoscopic surgery. And we can ask any laparoscopic surgeon, what is the most complicated thing that he feels in laparoscopy? The most tedious thing to do in laparoscopic surgery is suturing. Suturing is child's play in robotic system. It's as if you are operating on an open patient, you will do movements by your hands, you will be reflected in the instrument, and it is very easy to do suturing on the robotic system. So that's why there is a short learning curve, and there is the opportunity to teach your trainees also with better technology. So this is how a dual control system looks like. This is the patient card. Instruments are going into the patient. Through the patient card, this is the assistant or a scrub system. This is the chief operating surgeon, and this is the trainee surgeon. So coming to the role, कहाँ पे रोल है रोबोटिक सर्जरी का, कैंसर में कहाँ पे रोल है? मेनली अगर हम हेड एंड नेक की बात करें तो ओरोफेरिंक्स, लेरिंगोफेरिंक्स या रेट्रोफेरिंजियल स्पेस जो होती है, हमारे रेट्रोफेरिंजियल जो एरिया है, ये सारे ये तीनों एरिया जो है जो ओपन सर्जरी, आई एम सॉरी, Yes.